Welcome back to Ronnie, I'm Joe B. Today I'll show you how to correct a pelvic downslip through muscle energy techniques and non-thrust joint mobilization. Let's dive in. Pelvic or iliac downslip or iliac inferior shear is when the ilium gets stuck deviated inferiorly. The cause of this can be due to interosseous ligamentous laxity while being pulled or dragged by the foot, resulting to the iliac downslip along with hip abduction and lower extremity inferior shift. There's also ipsilateral or same side sacral bending but contralateral lumbar side bending. Iliac downslip can bring about low back pain on one side and a feeling of tightness. The pain increases with any leg pull activities. Furthermore, there is also a feeling of a leg length discrepancy. The assessment for iliac downslip requires the patient to do bridging first to balance the pelvis and then be in supine. The therapist should be on the dominant hand side, in this case, the left hand side. The therapist's first dorsal web space of the hand should be placed at the iliac crest first to check symmetry. After that, the thumbs reach down to check the anterior superior iliac spine or the ASIS for symmetry as well. Finally, both web space go down to check for the greater trochanter symmetry. Normal findings is that all bony landmarks will be symmetric. Abnormal findings will be that the downslip side bony landmarks will be more inferior than the patient's left side. In addition, there may also be contralateral trunk side bending or side bending away the downslip side. Let's imagine that the treated side is the left side. To treat the iliac downslip, patient assumes a prone position with left hand holding the table post and the left hip abducted 20 degrees and flexed 70 to 90 degrees to place the sacroiliac joint at a loose packed position. The therapist will be on the treated side at a lunged position. The right foot and chin stabilizes the patient's left foot, while the right heel of the hand is placed on the left side treated ischial tuberosity. The patient is asked to inhale, then upon exhalation, patient uses his left hand to push the body in a caudal direction, while the therapist counters through the heel of the right hand, providing a cephalically directed force or a superiorly directed force. This is held for 30 seconds hold for 3 reps. Hip hiking exercise can be provided for the patient to reduce or eliminate likelihood of iliac downslip recurrence. This is performed for 2 sets of 10 reps and eventually progressed to add hold times. So do you want to know how to correct a pelvic upslip through thrust manipulation? If so, then watch this next video. Thank you so much.